Assalamu alaikum. I'm Dr. Ahmed, working in healthcare system Oman. These days, the job situation in the Gulf has risen to the sky. So it's becoming difficult day by day to secure a job, or even if you land a job, the salary will be very low. So these kind of incidents and these kind of views are being heard from all over the Gulf, especially from the UAE, like the city Dubai, and also from the Saudi Arabia. So in UAE and Saudi Arabia, the job saturation for a healthcare professional has risen over the years. So is it worth to give your DHA exam or a hard exam or a KSA exam before securing a job? So I think these days it's not a good idea to opt for these exams before securing a job. So there are different options for you to secure a job first. For example, if you contact a recruiter or agency, or if you have a contact there in UAE or Saudi Arabia, your friend or your colleague or any of your relative is working there, you can ask them to apply for you in some hospital. And if some hospital is willing to give you a job because of your experience, then you can complete your steps of these exams like MOH, hard, and also the data flow document verification, because the MOH and hard are not very difficult exams. So you can give those exam after the preparation of 1.5 months or 2 months maximum, and after that you can move there. But these days the salaries are comparatively very low in UAE and Saudi Arabia, especially in clinics which are in peripheral areas, and the clinics which have a very low turnout of patients. So think before opting any site. Okay, think before opting to go to any country and get a proper information. After that you struggle for that. On the other hand, if you see, there are many pathways for Europe, and also in few Gulf countries like Qatar and Oman, the situation is a little bit different. Still, in Qatar and Oman, the job saturation is comparatively low, and also the salaries are competitive. But obviously, you should opt up an option which gives you at least a postgraduate degree, a good salary, and also you should have a chance to get a PR, a permanent residence, or a passport of another country. And for that, the best options are obviously Ireland, UK, America, and recently the best option is Australia. So you should get information about those countries and start your struggle or start your pathways to go to maybe Ireland, UK, America, or Australia. There are other countries as well like Germany, Uruguay, Luxembourg, and I have uploaded all the videos about all these countries, that what are the procedure and pathway to get a job there. But at the end it's your choice. And another thing is, whenever you want to move to abroad, for example, if you're an Indian or a Pakistani or Bangladeshi doctor and you want to move abroad, you need to see, or you need to look into the matter, that why are you going to move? Are you moving for the better salary? Are you moving to get settled there, or you want to get a degree? So all these three steps or these three targets you need to think about before going towards any country. Because I have seen people and I have heard from many colleagues or juniors who blindly move to some country, and after that they are trying to move away from that country to another country because they moved there for something else, and now they want something else. So my point is, if you want to get a better degree, obviously your destination should be Europe or America or Australia. And if you want a better salaries, is still your destination should be Europe, America, Germany, or Australia. But yes, if you want to stay for a while, maybe 2 years, 3 years, and then you want to move out, or maybe you want an urgent job and for maybe 2 3 years, then okay, Gulf is the destination for you. But ultimately you're going to have to move out of these countries, because even after living maybe 10, 20 years, 15 years, your situation will be same the day you moved in these countries. So all these things you need to consider before making a plan to move abroad. Thank you so much.